Now there are two methods for the determination of blood pressure. One is called as the direct method, in which we pass a cannula into a vein or prominent vein, and then we attach this cannula to a pressure measuring device. This is an invasive procedure and it is not used frequently for normal procedures, but it is only reserved for cases when the surgeons are doing operations on the heart or lungs or the major blood vessels. So it's a most accurate method for determination of the blood pressure. The second method is the indirect method, which is also called as the auscultatory method, in which a cuff is wrapped around the arm and then the blood pressure is measured by a technique which you will learn more about in your practical classes. Now the next is the mean arterial pressure. This is a very important concept, and this mean arterial pressure is the average pressure that is present during whole of the cardiac cycle. This mean arterial pressure is not equal to the systolic and the diastolic blood pressure. For example, if the systolic pressure is 120 and diastolic is 80 millimeter of mercury, then the mean will be equal to 100 millimeter of mercury. But the problem here is that in the cardiac cycle, the diastolic blood pressure remains in the arteries for longer time. For example, 2/3 of the total cardiac cycle time is occupied by the diastolic pressure, and 1/3 of the time of the cardiac cycle is occupied by the systolic blood pressure. So most of the time the blood pressure is very close to the diastolic pressure. So there are two methods for the determination of this mean arterial pressure. One is mean arterial pressure is equal to diastolic blood pressure, which in this case was 80 plus 1/3 of the pulse pressure. Pulse pressure is the difference of the systolic and the diastolic pressure. So 1/3 of the pulse pressure will be equal to 40 divided by 3, and that is roughly about 13. So 80 plus 13 is 93 millimeter of mercury. So normal blood pressure in a case of 120 over 80 millimeter, the normal mean arterial pressure will be 93 millimeter of mercury. The second method for the determination of this mean arterial pressure is, since 2/3 of the time is occupied by the diastolic pressure, so we multiply this diastolic pressure by 2 and then add one part of the systolic pressure, and then we divide whole of the sum by 3, and that will give us the same value of 93 millimeter of mercury. But roughly we usually round it off as 100 millimeter of mercury pressure for the mean arterial pressure. The significance of this mean arterial pressure is that this is the pressure that is pushing the blood through the arterial system, because there is difference of pressure in the arteries, which is the mean arterial pressure and the venous pressure, and this difference will push the blood through the arteries. The mean arterial pressure is different in different age groups. For example, in a newborn, it is around maybe 70 millimeter of mercury, and then it keeps on increasing with increasing age. You can see here, and at of mercury, and then as the age advances, it becomes even more, and 8 years of age, it is about more than 100, it is 110, and then at the age of about 80 years, it is about 120 millimeter of mercury. Now the physiology of veins. The veins have got different functions. Therefore have been mentioned here. One is the conduit function. Previously it was considered that the only function of veins is that they transport blood to the heart from the peripheral regions, and this function is helped by the presence of valves in the course of their pathway. So this is the conduit function. The second function is the capacitance function. This means that the veins have got the capacity to store blood, and about 2/3 of the blood is stored in the veins, and this stored blood can be utilized by the heart to increase cardiac output whenever there is need to increase the cardiac output, and this is because this capacitance is because of the elasticity of the walls of the veins, and this elasticity helps to distend these veins. The third function is the regulation of cardiac output. That is, whenever the body needs more cardiac output, then there is constriction of the veins because of contraction of the smooth muscles of the veins, and this will decrease their capacitance, so that extra volume of blood is pumped towards the heart, and that will increase the venous return and the cardiac output. The fourth function is the resistance function, and this is that the veins actually under normal conditions do not offer very much resistance to blood flow, but this whenever the veins are compressed by any organ, maybe abnormal organ or a normal organ, for example the gravid uterus or the presence of some tumor in the abdomen, then these organs will be compressing upon the inferior vena cava, so this will increase the resistance in the veins. So this increase in resistance will decrease the capillary blood flow, and that will lead to exudation of fluid from the capillaries into the peripheral tissues, and that will lead to edema formation. Now, to consider the functions of veins, two pressures are to be considered. One is the central venous pressure. This is the pressure in the right atrium. Central venous pressure is actually the pressure when the veins empty into the right atrium. So this is the same as the pressure in the right atrium, and the central venous pressure is the same thing. Now normally this value is 0 millimeter of mercury, because in the right atrium the pressure is 0. So this pressure may be as low as minus 5 millimeter of mercury pressure, or it may be as high as 30 millimeter of mercury. Now this central venous pressure is regulated, number one, is by the right ventricular contractility. That is inversely related to this central venous pressure. That means whenever the right ventricle is contracting more forcefully, then the venous pressure will decrease, and whenever the right ventricle is contracting with less force or is weakened or is diseased, then the central venous pressure may start rising. There are few causes of this. The diseases maybe, one is that there is weakness of the right ventricle due to infarction. So whenever there is an infarction of the right ventricle, that will cause a weakening of the right ventricular muscles, and that will increase the right ventricular pressure, that will increase the right atrial pressure, and that will increase the central venous pressure. Second cause is the pulmonary stenosis. That is, whenever the pulmonary valves are stenosed, this stenosis will cause difficulty of blood passing from the right ventricle into the pulmonary artery, and that will increase the pressure in the right ventricle, so will increase the pressure in the right atrium and will increase the right central venous pressure. The third cause of this increase in central venous pressure is the tricuspid valve's regurgitation. That means if the tricuspid valve is diseased, so that will increase the pressure in the right ventricle and will also increase the pressure in the right atrium, and so will increase the pressure in the central venous system. The second factor that is affecting the central venous pressure is the venous return. So this venous return is directly proportional to the central venous pressure. Any condition in which there is an increase in blood volume, for example, if we transfuse too much of blood to a patient, or we transfuse too much of the fluid to a patient, that will increase the blood volume, and that will certainly increase the central venous pressure. Second is that whenever there is an increased vascular tone or maybe dilatation of the arterioles, that will increase the venous return, because increased vascular tone will cause less capacitance of the veins, so that will also increase the venous return and will increase the right ventricular pressure and the central venous pressure. Secondly, the dilatation of the arterioles will also increase the venous return, because now there is less resistance offered to the flow of blood in the arterioles, and that will cause an increased venous return and so an increase in central venous pressure. Then muscle pump activity will also increase it. That is, normally the peripheral vessels, whenever they contract, they will compress these veins, so that will cause the increase in venous return because of that compression. So this muscular pump activity will also cause an increased central venous pressure. Then another factor is the gravity. That is, whenever a person is standing for a long time, and this will, because of the column of blood that is present in the veins, because of gravity, the blood will tend to pool in the lower part of the body or lower limbs, so that will decrease the venous return, and so that will decrease the central venous pressure. Then decreased force from behind. So you see, the flow of blood in the arteries and the capillaries and the veins is because from behind the left ventricle is pushing the blood onward through the circulatory system. So whenever the left ventricle is diseased due to any reason, that will cause less force from behind, and that will also decrease the venous return. As I told you, there are valves present in the course of the veins, especially in the lower limbs, and these valves help to cause the flow of blood towards the heart and not away from the heart. So these venous valves are actually very helpful in the venous return. So if due to any reasons these valves become incompetent, that is, their function is not up to the mark, so what happens is that the blood starts pooling in the peripheral parts of the limbs, because now the valves are not functioning, so that this will also decrease the venous return. Another factor is the strong right ventricular contraction. Whenever the right ventricle is strongly contracting, that and during the relaxation period, the pressure in the right ventricle may decrease up to about -5 millimeter of mercury, because most of the blood from the right ventricle is pushed into the pulmonary artery, and this will then create a sort of vacuum in the, having a sort of pulling effect on the blood present in the superior and the inferior vena cava, and that will cause an increase in venous return. Another factor is the respiratory pump. During inspiration, intrathoracic pressure becomes very negative. It is -6 millimeter of mercury, and this very low negative pressure has got a sucking effect on the blood that is coming in the thoracic cavity, so that will increase the venous return. Right atrial pressure may be increased up to about 20 millimeter of mercury. So sometimes there are certain conditions in which the right ventricular pressure may be as high as 20 millimeter of mercury. In number one is the right heart failure. Second is the pulmonary or tricuspid obstruction, or whenever there is overtransfusion of fluid. So you can see here in this picture the venous pressures in the different parts of the body. Now you can see, because of gravity, whenever the person is standing still, the pressure in the foot veins is as high as +90 millimeter of mercury, and in the femoral vein it is about +40 millimeter of mercury, and in the hand veins it is +35, and in the here iliac vein it is about +22, and then in the this vein it is about +8, and then at the level of the heart it is about 0 millimeter of mercury. And then in the sagittal sinus, important thing is that in the sagittal sinus the pressure is even negative. In the veins it is about -10 millimeter of mercury pressure.